recently on the 2nd of this month, Dr. J.S. Sastivaru, he has left us for his heavenly abode. A man of great simplicity, and he has virtually come up from the roots, grassroots, and born in Nandigama village. He served, he passed out from the Homeopathic College of Gudivada, and he joined the government and started his practice in Nalgonda. And from there on, he rose up to the heights to become the medical officer, subsequently the superintendent of the Homeopathic Hospital in Hyderabad, and served in various positions as a member of the Central Council, and he was the president of the Indian Institute of Homeopathic Physicians, and also finally as the honorary president for lifetime. And the government of India was also pleased to award him the confer on him the honor of Lifetime Achievement Award. So, with these few remarks, I pay my homage to my teacher, my guru, and I dedicate this small talk to him. As the title says, my subject for today is merely to introduce the subject of homeopathy and its utility in tribal welfare. And it's really not something new. Most of you have already been introduced to a lot of these issues. You're working very practically. I've only organized a few concepts, few thoughts, and my duty here is merely to provoke your thoughts and fire your imagination so that we can put our hearts and our heads together and see how we can take this forward. I would like to just go about in introducing what the national policy is on this and what is happening in the country, in the state, and then what can be done. So I won't be discussing anything about the therapeutics for today because there will be a lot of that being discussed and most of you are already familiar with that. So I'll be discussing about some salient aspects of the policies and then we can see how we can take this forward. Is there any way that yeah. Anyway. Yeah, that's fine. As you can see, there is a substantial population, and out of that, the tribal population is only 8.2%. But still, this is the group that really needs some attention because they are the most deprived lot in terms of facilities, amenities, and all that. So, our thought process, I thought I will share this with the group here today because most of you are also very familiar with the agency areas and you're also working in those areas, and I'm sure you must be doing a lot of work whether with this background or not, but in a very spontaneous way. So I thought we would like to put our heads together and see how we can work more organizedly in this manner. So out of the whole ST population, a substantial amount is in the North India, but we have our own share, as the next slide would show. This is briefly a demarcation about demographical demarcation about how the tribal areas are and where they are all mostly prevalent. The next one. And as you can see, Andhra Pradesh enjoys 6.3% as against a substantial amount in Madhya Pradesh and Chhattisgarh and other parts. Arunachal Pradesh is the biggest in that sense. Next. So, according to the government schedules, these areas in Andhra Pradesh have been defined as the scheduled areas for tribals. And Visakhapatnam, Godavari, Adilabad, Vijayanagaram, Prakasham. These are the areas where we have a lot of this population, and they are the ones which are really asking for support and for help. And like it was already discussed in the morning, how is it that homeopathy can reach out to them? Allopathy is also doing its bit of work, but it is not sufficient. In fact, in 2005, when the first NRHM was launched, the then Health Minister Anupami Ramdas, he himself admitted that they have not been able to offer the kind or achieve the right kind of results. So much so that they are having to now involve other sciences such as the Ayush department. So we do have a very big role here. Next. So the common areas, I'm sure most of you who have been working in these tribal areas, you would have come across a good amount of these problems. Most of them are gastrointestinal, dysentery, parasitic infections, malnutrition, diarrheas, and acute respiratory infections. Besides this, their eating habits, food habits, which are also totally disorganized. They are very prone to nutritional disorders like vitamins deficiencies, mineral deficiencies, and even faulty food habits. All these things contribute to a major health issues. So our focus is not just merely in giving medication, but also to understand their lifestyle, what is going wrong there, and how can we remedy that with proper advice, and how can we give them the right kind of awareness. So education and awareness of their imparting to them is as equally important as you know, as you're a doctor. We had a sharing in the morning where you say doctor-patient relationship is important, primarily not just to medicate and dispose him of, but also to understand where is his illness coming from. Is it from basically a nutrient level, or is it a physiological, physical level? Hahnemann has classified diseases. I'm sure many of you are familiar. In the classification, there is one part which talks about only indispositions. The other part is the chronic diseases. So in indisposition, you don't really have to intervene. All you have to do is to please correct your lifestyle, do the correct dietary work, and that is sufficient to take care of your illness. When a person walks in with hyperacidity and he talks about eating only late in the nights or having biryanis, you don't really have to give medication there. All you have to do is give the right advice, and that is enough to take care of the problem. Like that, in most of these areas, deficiencies and faulty food habits are the ones which can be treated completely by simple advice. And this is where we have to strengthen our knowledge base also. Next. Apart from this, these are some of the very defined diseases that are more prevalent in these areas. I have not really organized them as section-wise, but as you can see, most of them are all infections. And issues like AIDS, STDs, and scabies and yaws, and these are all problems that come out of poor information about how to conduct themselves or how to take care of their hygiene. I think if you can just spend a little time on how to help themselves with their hygienic lifestyle, we can avoid a lot of these problems. Besides, of course, the next level is to understand where the treatment has to be given. Has it to be at a very psoric level or at a deep psychotic or a syphilitic level. Next. I'll just take you through briefly what is happening in the health policy, how it has come to build up here. So a little sharing about the information about the issues that are majorly being affected by the nation and what we are giving attention to. Now we have a very strong program going on called Mother and Child Health, and as they were already mentioning in the morning, these comprise a major part of our health attention, and these are the areas that needs to be given a lot of support, the mother and the child. So to understand that, where is it that we stand here? The maternal mortality rate, as you see, is a substantial amount that is causing the problems, primarily for various reasons such as lack of access to information and how they are being taken care of between the childbirth and the pregnancy levels. Here, due to improper care or facilities, there is a very good possibility that right from the starting of the pregnancy, the conception, till the delivery happens, a lot of things can go wrong. As you know, the first 3 months are majorly important ones, and what the mother does to herself, her nurturing, her nourishment, and how it lets the fetus grow within, defines what the child is going to be in the next years to come, the future. Unfortunately, people don't really understand what needs to be addressed here, and they end up having a lot of complications. So you have live births or premature deaths, or even there has been an ignorant drug abuse. I'm sure most of you are aware about the thalidomide situation. A long time back, way back in the West, they just couldn't take nausea that happens during pregnancy. They started using a drug called thalidomide. They ended up having children with all shortened limbs or totally disfigured bodies. So much so that you must understand what happens in the first 3 months is of a prime importance, and how you take care of the mother and the child. So the nutritional deficiencies can set in here. So do the mineral deficiencies. So as it says, anemia in women is a major issue here, and the survey on the deaths, it indicates hemorrhage, sepsis and abortion, spontaneous abortion, primarily because they are not taking sufficient care in proper nutrition, or if they are not taking care of their hygiene properly, they develop sepsis. That is, in the process of delivery, they develop septicemia, and then the mother dies. This is more towards the health of the mother. Next, please. The next is the infant mortality. We have just talked about the mother, now it is a child. Infant mortality is also a major issue that is problematic for us here, and more so in rural areas, obviously. And here, like I said, it is a faulty care that is being given to the mother, or immediately after the delivery, how is the infant being taken care of? Are they being given sufficient attention or not? Goes a long way. I'm sure most of you would have also been dealing with what does a child or an infant do if there is lack of milk, lactation issues, how are they feeding the child, what kind of complex foods they are feeding the child, and how is it affecting it, so on and so forth. Next. So this is broadly the national health profile. About 45% of the children are underweight, and 38.4% are stunted. Poor growth, marasmus, protein energy malnutrition. These are very common problems that commonly affect in rural areas where there is not sufficiently balanced food ratios. As you know, in a growing child, as much protein, carbohydrates, fats and basic minerals and vitamins, these are essential to be balanced. But how do you know how much to offer? A lot of people don't even have enough information about breastfeeding. There is a huge program about breastfeeding also, and how the breastfeeding, the quality of the milk, the lactating mother has to take care of herself, which goes on to build the quality of the milk, which in turn can help the child grow. Or similarly, for that matter, how much of a protein do we balance? In the first 1 year, there is a different ratio. In the first 3 years, there is a different ratio. In the first 1 year, it is the mother who becomes the essence of nourishment to the child. Subsequently, in the next 3 years, by the time the child is the 3rd year, the teething happens, all the milestones build up, and here the child is becoming an individual, an I. So the real incarnation of an individual happens at the crossing of the 3rd year. But if there has been a poor nutrition and support system, this individual I doesn't come in enough. So it is totally a displaced person. If you notice, most of the times, in the first 3 years, the child always says, Ravi ki kavali, leకపోతే Ravi kadi kavalante, Ravi ante na peru anukondi. He says, it by referring to himself as his name. But once he crosses the third year, he says, I want this, I want this food, I want this car. The I comes in only after the third year. So this I-ness is an incarnation of an individual which happens only after the third year. But if this doesn't be taken care of in the first 3 years with proper nourishment, the I doesn't come in. The I continues to stay, and then it takes a long time for this I to incarnate, which will again set back a whole lot of milestones subsequently. The emotional growth, the spiritual growth, so on and so forth. So, the nutritional issues and the anemia are the major contributory factors. So, in this context, I would like to just say, if most of you are able to put together some formulations, some personal combinations that you have been able to see that they're working, be it at a very Ayurvedic level, at a nutrition level, please work on them, because the simplest of the solution to anemia is your til laddus or your jaggery laddus or jaggery and your peanut. Nothing more complex than that. It's as simple as that. But if we can put together some things like this, these are the things which are most economical, easily accessible, but they must be provided on a regular basis. So some issues like this, if you can slowly add to your advice when you are talking to your mother, to the mother or the child, they go a very long way. Please keep that in mind. Next. So the major causes of infant mortality, as you can see, are prematurity. Again, because of improper health care by the mother, the child gets aborted early or they get delivered early. Low birth weight and poor intrapartum and newborn care. Obviously, if there is no facilities available in the peripheries, rural areas, the newborn care will be definitely at a risk. Diarrheal disease, ARIs and so on and so forth. Diarrhea is probably one of the most common problems for these things, as you see in these areas, and how to take care of the diarrhea. Remedies, I don't really have to share with you. I'm sure all of you have your podovellums, enthusiasms, and then your arsenic albums, campers, all this in your fingertips. But how to take care of the management? The ORS is something that you have to give it as a rule. Substantiating the minerals and substituting the minerals, vital minerals, through either coconut water or with simple salt and sugar with fresh lime. Besides that, the commensal bacteria, which are the probiotics, which are also equally necessary to be given, they can be offered through simple whey water. If you strain the curd, it will drain the water. That is. That is much more active, it's much more alive. That is a good probiotic. The simplest that you can use. Otherwise, if you go to a nursing home, they give you Sporelax, Economs and whatnot. You have to pay through your nose to buy that one simple sachet. All you can do is to get it through your curds. That is enough. So this NCDS is something that is just for your profile, for your information. This doesn't really become part of our discussion. But you see, the non-communicable diseases such as, again we are talking about lifestyle issues. Most of them come out of, these issues come out of the lifestyle problems such as your diabetes, thyroid problems, coronary vascular diseases, so on and so forth, cancers. But for classification's sake, besides the maternal mortality, infant mortality, NCDS is also a very good health policy making matter that they have taken into consideration. Next. Amongst the communicable diseases are AIDS, tuberculosis, malaria, kala-azar, filariasis, and I think some areas in these agency areas are very prone to filariasis, and we still see a good amount of that flowing in. Japanese encephalitis. Now, this is, I would like to spend 5 minutes on this. Japanese encephalitis, as you know, has been a major issue with Andhra Pradesh for quite some time. But fortunately, with the grace of God, it is no more so much of an issue. You will be happy to know the main reason is because of homeopathy. And I can probably say it is because of my teacher, Dr. G.L.N. Sastry Garu, whom I just shared this. Way back in late 80s, when the first cases were being brought in, he was the first one to understand that you have to approach this disease through. The first time it was thought to be belladonna, which was the first drug of choice for prevention. But it kept coming back. Though it was preventing, it was helping, it was coming back. So he had to take it to the higher level and then see that, we have to really route it out through the miasmatic approach. So he brought in the concept of following it up with its chronic, which is calcare carb, and then to route it completely, he added tuberculum at the end of the treatment. So the protocol now is belladonna, calcare carb and tuberculum, which is the true protocol for a prevention of Japanese encephalitis. So you give belladonna 3 doses, follow it up after 1 week with calcare carb, and then after another 15 days with tuberculum 1 ml. This is the capsule of the protocol. And subsequently, the ministers have noticed the difference, and then they have really taken it up as a state policy, and now it is being given as a regular preventive through the government circles for prevention of Japanese encephalitis. We have a wonderful success, that's a good success story. We have been sharing this with different parts of the country. Now in Kerala they are applying it, in Madhya Pradesh and Gujarat. And they've actually taken a page out of this, and then they have been discussing about this in the legal conferences, and it is also an international protocol now. And we are happy and proud to say that this has originated from Andhra Pradesh, from here. Dengue, leprosy. Dengue has been bothering us for quite some time now, and quite a few of us have also been treating very successfully and preventing them. Next. So, just to give you a brief idea, the Ministry of Health and Family Welfare, which is right at the top, it decides the health policies. And this ministry is divided into Department of Health and Family Welfare, the Department of Union Systems of Medicine and Homeopathy. There are 2 organs. And we belong to the Ayush, that is the homeopathic division. And this Ministry of Family and Welfare, this also publishes the pharmacopoeia, setting of standards for the drugs, pharmaceuticals, healthcare, and so on and so forth. This is just to give you an overview about how the governance happens. Next. Ayush is the new acronym that has been formed. Earlier it was all the Department of Indian Medicines and Homeopathy, ISM and H. But subsequently it has been now called as Ayush by virtue of the 5 major systems which are recognized by the Government of India. They are being practiced here. So in the 11th 5-year plan, this has been also included, and you'll be happy to know that about 12,000 crores has been budgeted for the Ayush in this 12th 5-year plan, which is a major boost for us, and we're going to do a lot of work eventually. We're also about 250 crores has been granted for setting up an All India Institute of Homeopathic College and University. And we're planning to see if we can bring it into Andhra Pradesh by grace of God and help of the ministers who can actually prevail upon the CM to make this proposal. We've already put the proposal and we are waiting for some good results to come up. If the All India Institute of Homeopathic Sciences come, which is like AIIMS in Delhi, if that comes up, then we will be having a good connection with a lot of biotechnology sciences and informatics and different divisions coming together. There will be a very good boost in homeopathy for us. Next. So the vision for Ayush is also not just to promote homeopathy, the health and all that, but also the conservation of medicinal flora, fauna, metals, minerals, so on and so forth, which we use in our medicines, enhancement of outreach of Ayush healthcare, and to integrate Ayush into the national NRHM, National Rural Health Mission. Quite a lot of us who have been working in the peripheral areas, I'm sure you must be having a first-hand encounter with the flora, the flowers, the herbs, the plants, and you really realize what is the benefit and how we have to take care of them. So this is one more area that I would like to appeal to our friends. If you do have an access to integrate your work with them, let us put our forces together. We have to see how we can conserve this flora and fauna, how we can help them build better. The commissioner, the Ayush department this time is very proactive. They are willing to have, support any initiatives. So if you have any good projects, proposals to how we can integrate our homeopathy and also in support of the medicinal plants that we need to use, we can take it forward there. Next. So this was the 11th 5-year plan. The 5-year plan, it provides an opportunity to restructure policies, facilitate approach that they encompass individual health care, public health, sanitation, so on and so forth. Where do we stand in the 11th 5-year plan? We will see next. This is just an information how the health policy came to be, and this was formulated in '83, and it has also encompassed the Ayush systems. So, which is in its way a major boost for all the other systems, the tribal systems, the traditional systems. These are also being acknowledged and taken into cognizance by the Ayush systems, provided you have enough of documentation to take it forward and they are willing to support you. I have seen some time back when we had visited the Maradmali forest, we have seen some traditional practitioners there doing wonderful work towards taking care of different liver problems, and that is actually a dying science, which is what we have to conserve and which is what we have to preserve. So we would like to encourage a lot of such traditional practitioners and their wisdom, and how we can go about it is another area that we need to work on, because this is a wisdom that has not just come from a person, but it has come through ages and it lives alive in the area. So this is something that we have to be present to. Next. So finally the NRHM, which was launched in, like I said, 2005. And next please. The objectives were to basically adopt different key issues such as reproductive and child health, the national disease control programs, and integrated disease surveillance project. So apart from this, their objective was also to mainstream Ayurveda and the whole Ayush systems, which is where we had to play a very, very strong role, and we were a part of that in 2007, where we managed to we bring in a lot of health policymakers, manufacturers, and NGOs, teachers, practitioners, and all of them assembled, and they put together a whole lot of ideas about how to bring in homeopathy and how to use it properly. Then they drafted out a policy, which is what we have now as NRHM, and how even homeopathic doctors are now being treated in different aspects. They are trained on a regular basis. If you know, NRHM is being released in 3 phases. The 3rd phase is yet to be completed. Some of them have already been absorbed as contract doctors, and they are already being participating in this government health programs. Next. As you know, each Ayush system has a different strength, and it has to be harnessed. And this campaign, especially for homeopathy, is being monitored and promoted by the Central Council for Homeopathic Research. As you know, the homeopathic department has 4 major bodies. One is the Central Council of Homeopathy, which is purely working on policies, standards of education. The other one is the Central Council for Homeopathic Research, which is probably the most powerful organization. It goes about offering different technologies for doctors, for organizations, and it also promotes research. If you have a very good project and you develop a good scientific document on that, they are willing to fund you. So these are called extramural researches, and in fact, if there's a good proposal from WTT, they'll be happy to fund you if you can only document it properly and then forward it to them. Some trust areas, some core areas where you need support and where you know the doctors can work. So it's my secret desire that we do something on the work that you're so good at in service areas, in particularly remote areas. Try to see if we can develop a proper document on this and take it forward to them as a proper proposal. They'd be very happy to support us here. Now, about the national campaign of homeopathy, I was very moved by this particular sloka. Apparently, in remote area of Tamil Nadu, there is a temple exclusively for mothers to be or who are pregnant, and the whole prayer there is for the God. I mean, quite a lot of mothers are, for some reason, they keep having missed abortions. They lose pregnancies. They are never able to get pregnant again. It's such a painful experience for this whole couple, more so for this young mother. So the only way they have to offer is to appeal to someone for help. And in that context, apparently, there is a temple which provides this particular strength and this faith in Tamil Nadu. And that is where this sloka is also being chanted. As you can see, it's a Garbha Rakshambika Stotram. A part of it is on shared. But what Osho has said is really moved me. In the sense, before, the moment a child is born, the mother is also born. She never existed before. The woman existed, but the mother never. A mother is something absolutely new. It's such a fantastic experience, to become one and transform into another. It's a blossoming of a new entity, and to gain that experience, you should be blessed, and that is what this is all about. So that is why, in the program of mother and child, the mother is so important for us. So this is just a snap to share with you about how the national campaign was kicked off in 2007 and how homeopathy was also a major part of this. As you can see, the Department of Ayush and Central Council for Research in Homeopathy were the major stakeholders, and they involved a lot of organizations like you, teachers, colleges, and different manufacturers, policymakers, and different organizations to bring this all together. It's a very organized and well put up program, and I think we should take a good advantage of this. Next. So like I said, it happens in 3 levels. So in the second level, it moves from the center to the state, and we have our then state minister who was kicking it off, and then it is taken into a state level, the next level. Next. And in the second level, in the 3 tiers, they offer different training programs. So as you can see, this is an ongoing training program. All the colleges are offered, they were brought into this thing. In Rajahmundry we had, in Hyderabad we had, in Kadapa we did, and in different districts also, these NRHM programs training for different doctors, so that they can become trainers to train further doctors, so at different levels. And we involve a lot of other NGOs, ASHA workers, different support systems to gain this training here. Next. So this is about a sensitization workshop where you are actually sensitizing the mothers about different aspects of what is it to be a mother and how to take care of your health and how to make sure that you carry your pregnancy properly and how to take care of your infant after she is born. Different details are offered here. We had an opportunity to involve the college, the fourth year students, the interns, and it was beautiful sharing there. They had a lot of first-hand training there. Next. And health camps. Next. So the National Task Force is something that becomes out of this training, and this task force is identified and it's taken up to different levels. They are the ones who are actually executing this whole programs. Next. So the workshop and the objectives was to sensitize the stakeholders, policymakers, physicians, etc., and to bring about great awareness, and also to integrate homeopathy in different systems. So this was what was being put together here, and you can also be a part of this. The latest information I have is that they are extending this NRHM program for another 2 years, but I'm yet to confirm that. But if that happens, it would be a very good opportunity for us to also take help from this and be a part of this. Next. So in this NRHM program, the government has published 5 books which are supposed to be the resource material. These books are available, and then they offer different technologies to how to take this forward. There is a beautiful system called algorithms, wherein if you have, let us say, hyperemesis gravidarum, the nausea that happens in pregnancy, the patient walks in with that. So how do you take that from there to the next level? It's like a flow chart of a software. So if there, then what do you do? If this symptom is also associated, which drug? So it's a beautiful book, and all of them are designed like that for different levels. And this is a resource material that is given to all the participants, and so that they can impart it properly. So we have one book on strategic development of homeopathy for mother and child care. So this is essentially for people like, for instance, if Seshadri Garu was interested, he would be given a book like this to take care of putting this program across. It will be a good handbook for policymakers like him. Or the next one is homeopathy for mother and child, an overview for allopathic physicians. As you know, homeopathy has grown very vertically amongst homeopaths and maybe a lot of other interested people. But we need to integrate homeopathy with other systems, be it an Ayurvedic or be it an allopathic physician. So we have to talk a different language. How do we go about it? We give them a book which is essentially meant for allopathic physicians, so that they can understand homeopathy in a very allopathic way. It's easy for them. Then Manual of National Workshop on Homeopathy for Healthy Mother and Happy Child. So different disease conditions, different posters. Integrated Management for Pregnancy and Childbirth. So these are the major books that are resource material that is shared, given as a training kit when people go in for these programs. Next. Just a few examples of the resource material. Next. So this is for child care. So these manuals come like this, and it has a substantial information for pediatrics, for mother health, so on and so forth. Next. Next. Just a few examples of the resource material. They also offer a lot of posters like this, which can be put up in your clinics or in different public places, so that people can, these come in different languages, regional languages. Even in Telugu we have a lot of them, which can be put up. Next. So my final core aspect of this discussion is, what is it that we can do? How is it that we can participate in this? What has it got to do for us? So my appeal is that organizations like us, like the World Teacher Trust, their clinical services backup should be encouraged to participate in managing and supporting health services, community centers, sub-centers, primary health centers, where public health system is deficient and inadequate. As you know, in the rural areas, the reach out to health is gradually fading away as you go deeper and deeper. But this is an area where we can reach out because we have a zeal, a passion, a need to serve. And we have, what I am trying to share here is that we have an organized material, information and a government to support your passion, your zeal in a very, very proper way. If you would like to align yourself and then take it in an organized way. So we can come up with our own ideas, organize them properly and then come approach the government and request them that we would like to take this into this tribal area or into this zone, and they'll be happy to help you. I was just having a discussion with our Ayush department, and they're very eager to receive any such recommendation, requests or proposals. So I'm just sharing this openly so that we can give a serious thought to it and see how we can take it forward. We can also, as I understand, there are several organizations, NGOs which are working in different aspects. Some of them are, let us say, into microfinance. Why can't we support them or take their network into support, go reach out into these areas? Or there are some organizations from WHO which are purely working on only breastfeeding, awareness of breastfeeding campaign. Or some NGOs which are promoting only ORS. These are the organizations that we can align our thoughts with or see how we can work together as a partnership. So there is a partnership between two organizations and there is a partnership with the government to support this. So this is something that we have to proactively take a responsibility and see if we can drive this. That was a recent information, some Girijan hostels have been already being supported by the Ayush department in preventing dengue or swine flu or even malaria. There is one organization from one party from Switzerland who has been working on a herbal remedy for malaria, and I was very happy to learn that that's a trust area that we can focus on. I just learned it today, so I'd like to take this forward and see how we can align ourselves with that group there and see if we can bring this new remedy into our malaria areas. Next. So, even diagnostic services, as I was discussing with you, assessing and the diagnosis is a major area that can probably prevent 50% of the issue. If you can know that this mother or this child is anemic or it is minerally deficient a little ahead, we can go a long way in trying to address it even before the problem becomes very problematic or malignant in that sense. So we can also support these, like I was mentioning, the government is willing to train you in diagnostics or in some para health areas, which is where we can also subscribe or enroll ourselves for the training and then become part of that program. It's a little time to warm up. There are some, especially in areas like prevention of STDs and AIDS, which is so rampantly. See, one of the problems with the tribal areas is that there's a lot of inbreeding that happens. They have an indiscreet inbreeding that happens within the families, and then they have no restriction about some of their activities. So education and also helping them to prevent these issues like sexually transmitted diseases or AIDS, and how we can prevent transmitting it to the infant, so on and so forth. These things are of vital importance. All it requires is to understand it and share it with them and help them to get out of this. So there are organizations which are which are strongly promoted by WHO, which go about giving awareness about this AIDS and STDs, and they offer, they promote free condoms and different birth control systems as part of their training. So we can also see if we can align ourselves with them. So as I was mentioning, the Ayush government department can be approached to permit the world visitors to train ASHA workers and other ancillary support staff to campaign and promote awareness of homeopathy and its benefits amongst tribals. As I said, see, communicating about homeopathy and its benefits in the regional languages and the way that these people can understand is very important, very vital for us to take homeopathy forward. As they were discussing, the communication between a patient and doctor is of a very, very vital thing. Unless you are very clear about what they are saying. One of the richest strengths of homeopathy is the way that you let the patient express and the way they talk about their symptoms, which is where the individuality of the patient comes out. So I keep telling my juniors as I'm training, and then as we talk to them, if there is one strength in homeopathy, that is, let us say, sensations as if. This is something that is very unique to homeopathy. Only a homeopath is interested in understanding if the pain is utskuntunda, koskunatunda, mantunda, different types of sensations. Whereas for an allopath, it's a pain is a pain is a pain. That's it. But for us, it really identifies the uniqueness of this person's individuality when he says that my hemorrhoids are paining like this, and that brings out the individuality. So, like that, it's very important for us to understand the communication. And if it is in his own mother tongue or in the language that he understands and you can understand it, it builds a different relationship, different equation between you and your patient. All he wants to do is to be understood. That is the first primary need of a patient. And after all this discussion, we can also help in providing homeopathic kits, which are already properly doing, and we can promote kits which are meant for emergencies or which are also meant for different domestic services. So it also helps us to minimize the problem. If the patient is able to immediately respond to some need by a very simple kit, it saves the time from the problem to become an emergency. This is the whole crucial issue. If he's got a tonsillitis or if he's got a particular injury, and if he can immediately take, let us say, Staph aureus or Leadenfall, or if it's a bite, a sting or something, you can use echinacea or something. Before he reaches the nearest public health center or the other allopathic support system, he can be taken care of. This need not turn into something so difficult that it becomes a crucial, critical issue. So that is the advantage of having these emergency kits. You develop these emergency kits and give it to these people, these groups, or even give it to one ASHA worker, let her handle the community that she is holding. That is more than enough. It saves us a lot of quality time of a quality life. That is very vital for us. So, this was merely what I had wanted to share with you. I wanted you to understand that there is a thought process in the government which is willing to support, provided we put our heads together and then see how we can take help from it. There is already an organized thought process in this direction, and we have to put our resources together and see how we can take this across. And to this effect, I want you to kindly think and come up with your solutions. Maybe we can have some brainstorming. And I'm not giving you something that I have innovated, but it is something that's already existing. I've just put together some information for you. So I'd be happy if we can spend some time in the next 2 days to formalize these thoughts. Right? So with these few words, I would like to really convey my gratitude and thank all the organizers. My heartfelt thanks to Parvati Kumar Garu and to my dear friend Vijay Kumar Garu, who has been a major source of inspiration. His zeal and his passion towards homeopathy has really awakened a lot of other things within us. And Dr. Shastri Garu has been taking so many pains to put these workshops and this conference together. And to all of you for your wonderful patient listening. Thank you very much.
Dr. Srinivas has given us a lot of information and boost for further improving our working efforts. The last of all, he said, Ayush is going to help us, train us, and give permission kids to occupy. This is my submit. And we have already approached the Ayush about 3 years ago with all our activities, full activities, and submitted the matter to the Commissioner. But from there, I have changed the paper also through the Deputy Secretary. Nothing has happened. When you are now here, if you are able to do something for us, many of the WTD workers, they want some sort of permission to go to the villages. They are ready. They are well equipped with the system of homeopathy. But only we are not able to give them permission to go and do something. If it can be utilized, it will be of great help to the World Teacher Trust members and the families as a whole, in addition to all other tribal areas, wherever they go, they can do something. In all our centers, there are so many people who are very much inspired with homeopathy. But the only drawback is this certificate or permission. Permission is enough, no certificates are required, no degrees are required. If a person, as you said, who has been trained with a qualified homeopathy doctor can go to the villages and give the medicine. Like that, if you give permission to the World Teacher Trust, to the World Teacher if a permission is given like that to the World Teacher Trust, yes. If a fellow is trained with your qualified doctors for about 10 years, he can go to the villages and do and give the required help. Even in certain cases within the normal limits. Of course, for example, delivery cases or any serious cancer patients, etc., they will not touch. Normal, as you said, you have given all these things, we will counsel them, we will train them. We will give them, ask them to give counseling to the people. How to maintain the mother, how to maintain the child in a healthy manner. Like that, we are already doing that. The same thing also we will do. While doing that, we can also administer a dose of homeopathy to them. So as you are already associated with them, you have given that little promise. And if you want, we will revive that application again, once again, and send it to you so that you will do something for the World Teacher Brotherhood, so that they will also be happy and we will go to the villages and do much more service. Now it is 11:30 tea time. All of you kindly go to the downstairs, take a little tea, then come back here. We will start our next lesson at 11:45 with Dr. Chandramohan, where he will speak on active diseases and management.